If I hadn't had the surgery, I think I would have lost the function of the left leg because the nerve was crushed so badly. The surgery has given me the life at my age, at least, that I wanted for myself and for my wife. This device, I'm just fascinated with it. And I guess it's still in the pioneering stage, and I'm now one of the pioneers. Thank goodness.
He had had a previous surgery, done the traditional way, but the surgery he had didn't address the foraminal stenosis of the axon L5 nerve root. So when I first met him, it was pretty clear, like, no, that's your problem, and until that nerve root is decompressed, we're going nowhere here. A lot of people had a lot of questions, like, why are you doing this? Why are you bringing an 89-year-old to the OR?
Most of the time when we talked, I was 88. Are you sure you want to go through this? And then I became 89, and the question repeats itself, and it sounds worse. I had confidence in him and enough to say that it's not much of a choice. I want to go ahead and get rid of this.
The challenge is to come up with a surgery where the benefits outweigh the risk. Doing Mr. Tucker's case traditionally would have been a colossal surgery and would not have done it. Yeah, no way. With these personalized implants, it makes an enormous difference because the preoperative planning is already done. So it used to be, all right, we're gonna shoot for this in the operating room, and we're gonna see how we do, and then plan accordingly during the surgery, and that takes time. Whereas here, with these implants, they're designed specifically for the patient. So now you can take on a very challenging case without the morbidity. The planning process for these implants is pretty simple. The engineers need the CT scan and the scoliosis series. Based on that, you can do the planning, or what implant, the placement, how it's all going to be fit together. And it is quite seamless so far as I get the computer-generated version of what that implant's going to look like. I sign off on that, and then boom, the implant arrives. When you're placing this implant in there, it locks in there and you can't move it. So you know you nailed it so far as the balance of the spine and getting the nerves decompressed.
Took care of the pain. It's gone. It's like a miracle. And it's still like a miracle because I'm used to just standing there, and my foot would start to hurt or my leg would hurt. And I'm waiting for it to happen, but it doesn't happen. So that's like a miracle.
I don't know what would have happened if he still had pain. He wouldn't want to go for walks. And now that he's out of pain, he's just fun. And we drive out to Ohio to my daughter. That's a 7-hour ride. We drive everywhere, and he loves to drive. And he's not uncomfortable.
I'm still recovering. It's 3 months. I'm being careful of some of my activities, stretching and lifting, because I want whenever a bone fusion is occurring, I want to make sure it has a good shot to do that. Gym time has been fun time for me. It's been on the shelf since the surgery, and now I'm just getting back into it. With the realignment accomplished with the use of the spacers, I'm walking straight up, pretty straight up.
Most surgeons are very visual. So when you see a nice looking film, yeah, you know it. You know it when you see it. And these films, yeah, they're perfectly balanced.
My grandchildren and children, the first time they saw me, Dad, Grandpa, you got taller.
It's a new life. It really is a new life because we're not limited to where we can go or what we can do.
The alignment both in the sagittal and coronal plane is perfect. A personalized implant is just built for that patient because everybody's spine, as far as the way they fall apart, is different.
He gave me a sample of the spacer, and I was transfixed with that, just to feel it and know what it was made of and how it was made. And I'm still transfixed by it, that this is going to fit in the particular recesses in my spine. It's a miracle how you could do that.